So hello everyone, thank you for taking the time to listen to my thesis presentation. Today I'm presenting my paper with a very long title, but it's all about network-oriented modeling, an AI coach, respiratory distress, and organizational learning. So what is respiratory distress? In neonates, it refers to a condition where the newborn experiences difficulty in breathing. Common respiratory disorders observed include respiratory distress syndrome, transient tachypnea of the newborn, and meconium aspiration syndrome. The prevalence of respiratory distress among neonates can vary depending on various factors such as gestational age, birth weight, and other underlying medical conditions. Common symptoms include rapid breathing, retractions, nasal flaring, grunting, and cyanosis, which is a bluish discoloration of the skin and lips. And to assess and confirm if the babies have respiratory distress, a healthcare professional uses diagnostic approaches such as physical examination, pulse oximetry, chest x-rays, and other investigations. So as you've probably already have seen around the slide, there are visualizations of a network. But what is a network and what is a mental network in particular? So according to Scherer's paper on emotions, understanding the brain's complexity is challenging due to cyclic patterns, recursion, and the absence of linear causality. And the brain's phenomena resembles networks. And so they suggested that networks can provide a useful framework for describing complex mental models. So a mental model is important for people to comprehend the world. They serve as a kind of internal construction that helps individuals to make sense of new information based on already existing information. And mental models do not only explain interactions within complex systems, but they can also play an important role in teamwork. You can call that shared mental models, and these refer to knowledge structures collectively held by team members. Organizational learning is a very multidisciplinary approach. It draws upon various fields such as information processing, organizational culture, and other fields, and this results in a very diverse range of conceptualizations. Individual learning of mental models serves as a foundation for these shared mental models within an organization, and this really facilitates organizational learning. So you can see organizational learning as a ongoing process of identifying errors and trying to rectify these. In my paper, I presented 3 scenarios with corresponding MATLAB models. The first scenario focused on the roles of a nurse and a doctor in managing respiratory distress. And as you can see, this scenario is divided into sub-scenarios, 1A and 1B. And I have chosen to do this to really clarify the distinct responsibilities of the doctor and the nurse. So to really show who does what during the medical procedure. These 2 base planes show world states in green nodes, and these represent the steps in the scenarios. The lighter green nodes are also world states, but these are not directly influenced by the other world state. That's why they are colored lighter. Each base level has 2 mental models, and these reflect the procedure structure. The actors are denoted as T for doctor and N for nurse. The doctor mental model is in orange nodes and the nurse in pink nodes. And these doctors and nurses have actions, and these rely on the ownership states. And these ownership states are colored in a lighter color. So for the doctor, for the nurse in a light pink, and for the doctor in light orange. The influence between world states is shown with black arrows, but it's also between the mental states. Blue lines show that the connection between ownership states to the world states and between the mental model states. And the yellow lines indicate observation arrows, so what they can see in the world. Then we go to model 2. In scenario 2, there are additional levels introduced because this time there is learning. So I wanted to incorporate learning, and the base level looks the same as 1B, but it's not. It's a variant, so it doesn't build upon it, but it has some similarities. For example, this scenario includes a context factor in which the doctor is feeling sick and fatigued. The first upper level focuses on adaptation and plasticity of the mental models. It involves learning and forgetting separately for the doctor and the nurse. The learning used here is Hebbian learning, and this is something that strengthens connections between neurons. And the presence of a second order self model captures the adaptability of a persistence factor of Hebbian learning, and a persistent factor quantifies the fraction of the learned value that remains over each unit of time. And in this case, in this scenario, the M states decrease when the baby is in a critical state. It's with this context factor because the baby is in a critical state, which makes this causes the doctor and the nurse to be stressed. In model 3, an AI coach is introduced at the base level, as you can see here. It observes a medical procedure and gives information to decision states, to monitoring states. These are in dark red. And this information goes to decision states. But these decision states, they are suppressed when the world states are happening as they should be. So this makes the AI coach not needed to signal decisions. However, when there is something going wrong, this AI coach initiates communication, and the communication states signal the corresponding W states for the doctor or nurse, and that depends on which deviation is happening. There's also organizational learning that you can see by in the W states here. There are connections between the W states of the AI coach and the doctor and nurse. The upper level contains higher order W states, and these specify the weights of connections from the W states to the individual ones. So my results, I'm only gonna try to mention the most significant things, otherwise I'm overloading you guys with too much information, but I'm still gonna try to give you guys a clear idea of how the scenarios progressed. So this figure really depicts a normal medical procedure without any significant deviations. The orange line, for example, shows that the nurse is preparing to assess the baby's respiratory vital signs. Then later you see, for example, this green line, and this green line is a state which means the respiratory rate is above 60 breaths per minute. And this means there's something wrong with the baby, because normally it shouldn't be above 60 breaths per minute. So when something is wrong, the nurse asks advice from the doctor. So you can see here that the purple line comes, which means the doctor is giving advice, and the dark green is the one that gives advice. The purple one is the nurse asking for assistance. The results of scenario 1B, this figure shows that there are two context factors. The baby is in a critical state from T1 to T50, and from T1 to T80, the family is in emotional distress. And as you can see, from T50, the yellow line starts increasing, and this yellow line stands for that the X-ray and other evaluations do not show anything abnormal. So this means that after the baby got out of his critical state, the evaluations show that the baby is getting better. And this is also supported by the green line, which shows that the treatment is finally working. It goes to 1. and the pink line, for example, shows that the doctor is providing advice, but the nurse is only telling this advice to informing the family about the situation at T is 80, because that's the time when the family is less emotionally distressed, which makes it a good idea to communicate to them. In scenario 2, we see a lot of different periods. So in the first period, I will try to keep it simple. You see this purple line, and it has 3 segments. This purple line means that the doctor is giving treatment. So he starts with giving treatment, and the treatment is working. This means that the treatment is working. But as you can see later, he switches to a different treatment, which increases this orange line. And this orange line means that the X-ray is showing that there is something abnormal. So there is something going wrong. And this is also seen by the green line, which goes to 0. So the treatment is not working anymore. So he switches back to the previous treatment. Then from T150 to 300, there is no critical ill baby. So no baby needs immediate attention. Then from 300 to 450, again, the same period happens, but with a new baby. But as you can see, the same mistakes are happening. From T450 to 900, a very big break is taken by the doctor. So he's trying to recover and improve his performance. And after T900, you can see that all the lines are going up and everything is going perfect. So the earlier break proves beneficial. So scenario 3, I try to show the dual capabilities of the AI coach. So as we know, the AI coach can monitor and signal, but it can also facilitate organizational learning. And this differentiation creates 2 distinct cases, one where there's organizational learning and one where there's only communication. And I try to show these differences by focusing on the process related to the world state 2 and the learning of the doctor. The world states in case 1 show nothing special. Everything is going as it should be. Maybe the only thing I could show here is that the yellow line goes down while the orange light goes up. The yellow line stands for the X-ray is showing something abnormal, while the orange line is showing means that the X-ray is showing nothing abnormal. So it cannot happen at the same time. So that's why the one is going down and the other one is going up. This graph shows the doctor's learning curve. The dark blue line here shows that the doctor starts learning. The orange line shows the ownership state, which is triggered by the dark red line, which means the mental model state. And eventually the neon green line shows the real world occurrence, which is WS2, the world state number 2. You can also see that there is a temporary increase in the communication state of the AI coach. But as you can see, it diminishes very quickly. That's because there's no need to communicate. Everything is going okay. So that's why it goes down again. It's nice to notice that there's like a small spike in the learning. So when it does communicate, the doctor learns a bit more than usual. These show the learning states. Initially, all the W states show a similar learning pattern. There's an increase, a spike, and a slight decline, which indicates forgetting. But you do see that the learning states never go to 0 because the AI coach taught them enough to understand most things. A thing that maybe would be a bit weird if I don't explain is the yellow line, why it goes to 0. So this yellow line is not influenced by the AI coach communication state. And this happens because the doctor is not responsible for informing the family. This is a role of the nurse, and that's the final step of the medical procedure. So that's why it doesn't get triggered. In case 2, there happens something very strange. You see that the world states are happening, but eventually there's a decline. And this shows that there are mistakes made during the medical procedure, which wasn't happening in case 1. We do see, however, that the world states never really reach zero. So the AI coach does signal the mistakes, causing the lines to increase again. So the doctors and nurse, well, in this case, the doctor is aware of their error. This graph also depicts the process behind WS2, but then in case 2. And here you see the dark blue line of the doctor, and you notice that he immediately starts forgetting. And this leads to the AI coach communicating and saying, hey, there's something going wrong, which makes everything going up again. So later on, there's again a decrease, as you can see, and the AI coach communicates again. The learning done by the doctor in case 2 is also different. As you can see, there was forgetting, then learning again and forgetting. And this time they do decrease a lot, and they don't stay constant. They only increase again when the AI coach notices a mistake and tries to signal this. So my conclusion, yeah, as we have seen, the AI coach can provide in 2 different ways, organizational learning and the monitoring and communication feature. Organizational learning observed in case 1 has a superior effect compared to the communication feature alone. In case 1, learning was consistent and reached a constant state, and the same for the world states. However, in case 2, the learning increased only when the AI coach signaled an issue. Case 2 also showed that there was a decrease in world states, and this means that there were mistakes. So overall, organizational learning resulted in better outcomes, but the communication feature did prevent vital mistakes, so it is useful. In the future, if I would expand this model, I would probably expand the communication capabilities. So instead of only signaling the doctor and the nurse, I would maybe also include other stakeholders. I think that would be beneficial. Maybe these stakeholders could be the patients and their families. And maybe by establishing these communication channels with additional stakeholders, the AI coach could improve coordination, collaborate, just the overall efficiency within the healthcare environment. So yes, this was my presentation.